See, there's a little plastic piece that right here that goes over the needle.
Mm-hmm.
All the needle does is the needle pierces the skin and the vein, and then we actually pull the needle out, and the straw stays in there.
Oh. Wait,
yours
so
is a little bit farther down, but like if you have it, if this right here is up here more,
mm-hmm.
when you bend your elbow,
mm-hmm.
it'll actually stop it. Have you ever taken a garden hose and gone like this to stop the water?
Yeah.
When you do that, it actually does that.
Oh.
So yeah, you just have, right now you just have this little plastic straw.
Oh,
in your vein.
I thought I had that too.
No, yeah, just this little plastic straw.
Oh. That's a lot. Yeah, I didn't think all of this happened. Funny.
Well, I can start IVs and give shots and all that all day. You come near me with a needle, we're going to have words.
Right.
What?
He's talking about himself personally.
Oh.
He said he doesn't have a problem giving them.
Oh.
Alright, we get the nurse to get some meds and then we'll bring him down and get his CAT scan, okay?
Thank you.
CAT scan?
Yes. CAT scan.
What's CAT scan?
It's a CAT scan. Scan to see if you're a cat.
That makes sense.
I think it stands for something. I think it's abbreviation for something.
Only if this room was bigger, I have more things to look at. It looks different in the video, my arm.
Did you get his whole explanation there?
Yep.
Did you get it on the thing there?
Yep. Everything. Looks weird. Wait, what is this? That's my blood.
Well, like I said, but that's usually before you go into any surgery or something like that, they will give you an IV. Because that way there, they can put fluids into you, whether you're awake or whether you're under, to make sure that you're hydrated and everything else. So.
Mm-hmm. It would be kind of funny if a doctor came in and if he said, this is my first time doing this.
That's why they go to all those years of school and residencies.
I mean like his first time actually doing on a person.
Like I said, that's why they go through all the schools and the residencies.
Door. I would be scared.
So they can get lots and lots and lots of practice.
I would be like I was a little kid then, screaming and stuff.
Well,
if it was
you figure most doctors, they start out after they get done with medical school, they finish their graduate school, all that stuff there, and then become a resident and get their residency, which is usually like 2 or 3 years.
Oh.
By the time these guys look up, they're like 35.
And when did they start?
Huh?
When did they start? When did they start?
They've already started.
How long does it take?
First, they practice stuff like that. They're usually they'll have animals that they can practice on, and usually like pigs because a lot of their skin features and stuff like that is a lot like humans.
What pig? Oh yeah.
So they use animals and stuff like that, and then as they become residents, where they're working in a hospital, basically they're like interns, which means you're working and you're not getting paid for it.
Oh.
That's where you're learning about stuff and learning how to do it under the care of a physician, under doctors.
Oh.
Okay, so when you're doing the stuff then, basically you're being supervised. So you have a doctor that's showing you how to do all these things. So if you have any questions, that's how you get your hands-on experience.
Hands-on. Wait, why is a pig the closest thing to a human's flesh?
They're talking about as far as for inside, as far as veins and stuff like that. There, when
it's only inside?
I'm talking like when they stick you needle-wise and stuff like that. So
so skin?
they use different animals that they use for different things. So, but
wait, so if I bend my arm,
for training,
what happened again? Is it the blood's gonna?
What's gonna happen is the blood is gonna start stopping up here. It's not gonna flow through. So you need to keep your arm pretty much straight.
To keep my arm like this.
It's just like a hose, like you have a garden hose that you have the water on with, right?
I was just making sure.
You know when you close up the hose at one point, it stays there until you let it go.
I have your medication for your headache, okay? They're going to take this CT scan, and then after that they're going to hook up fluids.
Okay.
So nasty.
Put away your phone like
getting the rest of this. Getting the rest of this. At least want to make it 10 minutes.
Are you allergic to any medicine?
No.
And
Is that for me?
what's your full name?
Another needle?
No.
Oh, it's not. Oh, yeah. I forgot.
What's your full name?
My as in first, middle, and last.
Full is everything.
Devon James Watson.
Okay. Date of birth?
September 3rd, 1997.
Okay, that's you. Let me give you the medicine. What number is the pain right now?
Well, all my ow.
There's no needle.
I know, but I mean that hurt. Like when you moved it, it kind of hurt a little.
What number is your pain at now?
As in my head,
Mm-hmm.
it's a little better than it
You're
was
here
earlier.
for your headache, right?
Mm-hmm.
Okay.
1 to 10.
Went down to a 5.
Fine.
Just let me sign this off.
Can I move my arm back, or you need to put something else in?
Hmm?
Need to put more in tomorrow?
This is like water saline to push the medication.
It hurts. This is how awesome I am. I don't drink water. I get it injected to me. Why does it smell like alcohol though? Like, or peroxide?
Thank you.
So, is it safe for me to move my arm back onto the
Devon,
bed?
it's safe for you to move your arm back. It's just. Okay. Devon, you can move.
The
your
doctor
arm.
said, no,
You
he
can
said,
move it a little bit. You don't have to be just like totally just.
but the doctor
Okay.
said if I move, bend it or anything, it's gonna stop and then other stuff. And I don't feel like being here any longer.
Maybe what you may want to do is maybe lower the back of the bed.
With one arm?
Lower the back part here. I'm just saying.
Wait, lower it.
This can lower, and then
I know,
instead
I
of
know.
it being more of a bed position, it will go more into a
No,
straight
I
position.
know that. I'm just saying, like, where is the thing so you can do all the stuff?
You know, we can find out where that is. Devon. That's not a problem.
Safety check.
But isn't that better than having to get a whole bunch of shots?
Maybe.
Yeah, that's how they put everything in. So that's how so like if you were dehydrated and you were unconscious and then you get water inside of you or fluids inside of you, this is how they would do it.
I do not want to be a doctor. I would not be good with that.
Okay.
I'm like, where do I put this again?
Well, that's why they go to all those years of schooling.
I'd forget it then. Armstrong.
I'm sure if you put your mind to it, you will be a good doctor.
I doubt it. You'd see me already coming back home. You'd be like, why are you home? I got fired. I killed a man on accident. Wait, why do they have the two trash cans? Because one has like the little
What
biohazard
does it
sign.
say?
One says biohazard, and the
Okay.
other one says trash. But I mean, like, what's biohazard? Like,
What do you think biohazard is? Think about it. First of all, the second part of the word is what?
hazard?
Okay, so that means what?
Chemicals?
No.
Hazard stuff?
Hazard.
Hazard stuff. Stuff
What does
outside.
hazard mean? Hazard stuff doesn't mean hazard stuff. What does the word hazard mean?
Chemicals?
No. Does that mean it's
Toxics?
No.
Germs?
No.
Hazards?
A hazard is something that's dangerous.
Technically, all the stuff I just described.
No, you just describe different stuff.
But that is a hazard.
We go ahead and start the fluid while we're waiting on radiology to be ready.
Right.
So they have to warm up the CAT scan tube and all that stuff. So
Wait, what's a CAT scan do?
it's basically a big donut-looking thing that you go in and it takes pictures of your insides.
Like organs?
Mm-hmm.
Oh.
Yep.
Okay. So what are we getting again? Or what am I getting?
You're getting a CAT scan of your head.
Oh. And what's that stuff? Is that stuff that...
It checks different things that... There's quite a few different things that the doctors can tell. I'm not entirely sure what the doctor's looking for,
Oh.
to be completely honest. But yeah, there's quite a few different things that they can tell from that CAT scan.
Oh. Wait, so is that water? Is that water?
Yep.
Or is that chemical stuff? Or water?
Salt water.
Oh.
Just water, just to hydrate you.
Wait, why you put... How come you put... Wait, you said it's salt water, right?
Mm-hmm.
So why would salt water go into my body?
Because your body needs, besides water, it also needs sodium.
Oh. That makes sense.
Sodium and chloride, which is salt.
All right, very good assessment there, Dr. Watson.
Thank you.
Hopefully,
The hospital has the doorbell?
Well, ERs by law have to be secure. So people that don't have a badge have to ring the bell to get in.
Ouch. Crap hurt. What's that for exactly? Take the water out.
Yep.
it regulates how much water goes. So they can make it go faster, they can make it go slower.
Oh.
All right. Moving back to when the radiology's ready for him. We'll be back.
Okay, thank you.
Wait, so when we get the CAT scan, is it going to be in here?
No, we'll take you to the radiology place.
Oh. And that is?
Mm-hmm.
Where's that at?
Where they take the x-rays. Push down and back around the corner. You walk right past it to get to here.
What's the thing for? 500, 496,
I don't know what all that stuff means.
1 minute, ML/HR. Basic mode? This is basic?
I don't know what all that stuff means.
Yeah. What is it? MLHR, LVTBI, HR. Oh, hour, minute. I'm confused. Hand feels cold. Well, at least this part.
Do you feel the water going in?
Yes.
What you do is start traveling throughout your body. What you're trying to do right now is get you to hydrate. And again, while you've been using the bathroom, has your pee been coming out dark?
No. Like light yellow.
That's dark then. That's
What's
dark
that?
enough. That's already, you're already dehydrated. Because if it's real dark gold, that really means you're dehydrated. But if it's gold,
What is yours?
Hmm?
What's your color?
it's probably yellow too.
Exactly.
So, but I'm not the one with the IV or MBMI.
Good point.
The point is, when you see that your pee is yellow, that's an indication to you should start drinking more water. Because you want it to come out clear. Because when you pee and it comes out clear, if it comes out in this almost this color like this here, if it comes out that color there, you know you're hydrated.
Okay.
But if it comes out any variation of yellow, you're already going towards the dehydration side.
Oh. Wait. Danger.
You want it to look more watery than yellowy.
Oh.
Okay?
That'd be weird if someone thought it was water. They drank it.
I mean, even if it comes, like I said, even if it's coming out of light yellow, you're going towards the end of the dehydration. You're past that midpoint, and you're going towards the dehydration side. You want it to look more watery. The more it looks like water, the more hydrated you are.
Oh.
The more yellow it looks, the darker it gets yellow, the more you're dehydrated, which means that you need those fluids,
Oh.
that water and the sodium, because that's important also. You don't want to take too much sodium, too much salt. That's why you don't eat a lot of
So it's supposed to be. Is this whole bag gonna go inside my body?
Probably.
It's more water I drink in like a week.
It's about how much you probably should be drinking.
Man, how much
Probably per
is
day.
that? How much does that say?
It says,
How much, like,
1,000 milliliters.
what's that? How much is
I
that?
don't know, Joanne. That's probably about. I would probably figure it's probably like a liter.
I'm having a whole liter.
I'm guessing. I don't
Wait,
know.
so kind of like the water was like this big?
Like a 1 liter bottle.
The bigger ones, like the
Yeah,
commissary,
yeah.
that are like that are longer, like wider
Mhm.
and longer. That's like 2 liters,
No,
right?
those are 2 liters. If this is 1 liter, then this is about 33.8 ounces. If that's 1 liter. And I'm pretty sure it is, but I'm not. Don't quote me on it.
You know something I don't understand?
Hmm?
Every time I get a shot or something, my arms and legs start like shaking.
Because you're nervous.
No, I know. Like I was nervous and all, but I mean, even after I leave and get out, my body still shakes.
Yes, that's just how you feel at that time. You are, that's all. So, other people feel that way too.
Is it inside there? Oh,
Hmm?
the wire goes in there, then up here, and then there, and then there. I thought that it was that the thing was just a line.
Now you know.
Yes. No, I know. Wait, why did they stop? Like the pregnancy stuff. Like when they stopped, when they did it with the place where Antonio was born. Like why Andrew stopped like doing like the deliveries?
They have a partnership with Southern Maryland Hospital, which is a little bit further down the way. So they're using Southern Maryland's facilities.
So Southern Maryland's military hospital now.
No, it's not a military hospital, it's still a civilian hospital. And what they do for the military people who are delivering, they have a special section just for the military people.
Oh,
Where
wait.
the military doctors see them and military nurses help them.
Well, I have a question. You know how, like regular hospitals, like Southern Maryland and stuff? I guess I'll ask you later.
Alright, gonna bring you down and get x-ray.
Awesome. So this coming out now?
Nope.
What?
That'll stay until you go home.
Seriously?
Yes.
What?
Because if they need to add fluid or take fluid
So
out.
I can't bend this arm
Yeah, you can bend it.
now?
Yeah, you can bend it. It's low enough down that you'll be able to bend it. You want to keep it as straight as possible, but you can
What?
still bend it.
That's complicated stuff.
Okay, you live. You're getting a free ride in a
Awesome.
wheelchair. Legs go out.
I feel like I'm a cancer patient.
Oh, you're a mental patient. You know that.
Okay.
That's why I don't do any of the transports with mental patients. They might not let me back.
Okay.
So I would continue everything.
Wait, so is this the CAT scan?
Yep.
Oh.
It's always odd when you walk out the door and you see stars.
I work for 3 stars. We actually work for the ER Surgeon General.
I feel like a little kid again. Getting pushed in like
See her all the
carts.
So it's like, oh, what's that?
We can come in here as a 2-star.
Okay.
And whenever he sees me, he's like, "Oh, hi, how you doing, Rick?" He calls me by my first name. It's like, that's kind of scary.
Why?
My wife does quite a few different. Does quite a few. Started quite a few groups on
Okay.
base, and his wife is a regular at some of these events that my wife started. CT.
Dude. CT scan.
Every time I say it was nice knowing you, and I'll think about you a lot.
You weren't kidding when it was like a donut looking thing. You mind finishing up?
You're gonna have to turn that off. We can't do that in here.
Oh, well, That sucks.
This is not.
the wall.
Okay, press the red button to stop it then.